we found out Dad had the stage 4 kidney cancer, and he wasn't going to be strong enough for surgery or treatment. And we knew that this was going to be a journey. We started with just 24-hour care with his caregivers. And then in July, he was upset, didn't feel good, and said, I want to go to the emergency room. So we took him to the emergency room. And it was very apparent at that point there was nothing, there wasn't anything we can do. We weren't going to treat him. So in July of this year, we said we got to do hospice. So we started with a hospice company that one of Dad's doctors recommended. And it was kind of a shock. It was sort of, okay, here we go. What is this? We didn't really know what to expect. We didn't know what we should expect and what we wanted. So we just started going with it. And
then it became apparent that we were getting frustrated because the inconsistencies from the nursing staff and our needs were not being answered or met. And so we thought, okay, this just doesn't feel right. This shouldn't be right. So we, at that point, started looking back into it, and we found Harrison's Hope. And immediately, the answers that we had were, the questions that we had were answered right away. And the biggest pull for us was having Dr. Chu available almost immediately for any answers that we needed. And to have Dr. Chu come on the first visit and meet with Dad really gave Dad peace of mind that he got to see a doctor. And then Erica came on as his sole nurse, and she comes every week, and the consistency between Erica's interactions with Dad, building a friendship and a bond, as well as Dr. Chu being readily available to answer questions and shift medication as needed, was exactly what we needed. So it really gave all of us peace to know that we could depend on Harrison's Hope to take care of Dad when we weren't around.
And in addition to that, a couple things. First of all, Erica just knew exactly how to connect with Dad. Of course, she's Italian, Dad's Italian, so that was the first good move. But she, really took advantage of that and said, let's connect. And with his memory issues, there isn't a lot of communication. There's not a lot of rapport always. But Erica established a rapport immediately with Dad that was awesome. But what's also awesome about Harrison's Hope is the collective effort, the patient care coordinator, that making sure that our answers, our questions are being answered. The social worker, Deborah, coming once a week, chatting with Dad, getting him to open up, talking about things that people don't ordinarily talk to him about. The chaplain coming by to visit, his willingness to embrace the Catholic faith, of which Dad, understands. He understands those words. So everyone's willingness to make Dad as comfortable as possible. We just feel like, you said at one time, Brian, in one of our meetings, where hospice is not about giving up. It's about changing direction, changing course. And I was thinking about this, when we first brought hospice on, we were thinking, okay, 3-4 months, and he's gonna be gone. Well, that's not the case. So he's now 8 months out, I think. So it's just such a phenomenal way to have your end of life, because people are coming to you, making you comfortable, making the family comfortable. There's no more trips to the hospital, no more traumas from that direction. It's just this is right. This is exactly how it should be done.
Absolutely. And the emphasis on comfort and care, keeping him at home where he's happy and comfortable, and come to him with what he needs instead of having to take him somewhere else. And the assets that you have available to take care of him and keep him comfortable is very impressive.
Very much so.